In terms of the numbers that are in hospital with COVID at present, what's the breakdown between vaccinated and unvaccinated, please?
Yeah, there are more vaccinated than unvaccinated, is what I would say.
There are more vaccinated. Okay.
Yeah. We'll say what we had on Pine Ward yesterday. So we've 24 beds on Pine. So 18 of those were fully vaccinated.
Okay, of around 26, 27 in total, is that right?
Well, 18 of the 24 on Pine Ward.
18 of 24, so that's more than three quarters. So three quarters are vaccinated. Do you find that surprising?
We do, and I suppose, like every member of the general public, we're hearing things on social media, we're reading guidance documents, and I suppose, I myself can see that the mixing, across society and across the ages, I suppose it has been at its height in the last 6 or 8 weeks as people have resumed normal or near as normal activity previously. We ourselves, I suppose, had a view maybe that when we had been vaccinated very early, January, February, that maybe there is that sense that it does begin to wane in terms of effectiveness. But I think the public health experts are actually attributing it most likely to the fact that even though there's 92% of the adult population vaccinated, they're saying that the total population isn't as yet 85% vaccinated, and that the volume of those vaccinated, coupled with the remaining public health measures, still hasn't actually in effect eliminated the virus. So it is spreading.
How sick, how unwell are those vaccinated people, for example?
What I would say, and I suppose I've said this at home as well, is that all of those people have been admitted to an acute hospital, so they are unwell. If they weren't unwell, they wouldn't be admitted to the acute hospital. And
are we seeing, we hear the national figures every week regarding mortalities every fortnight and every month.
We haven't had any COVID mortalities in months here in this hospital.
How close are ye to capacity regarding intensive care, stroke, emergency, high dependency beds for COVID patients?
So thankfully, I suppose we have capacity. So we've 6 in ICU this morning. 2 of them are COVID positive patients. We introduced a cubicle system into our ICU way back, middle, maybe Q2 of last year, which again supports that we have a greater ability to isolate patients. So we've 6 in ICU, we've 4 in HDU, and we actually have no one in our PACU beds this morning. So PACU is like post-operative care beds, yes, which we can convert and make those HDU if we needed to. So as it stands, really at the moment, present time, we're okay. I suppose the concern, and that's been voiced nationally, is the more patients that occupy your critical care capacity, it means the less critical care capacity is available for scheduled admissions, people for elective surgery, people for big surgery that will require critical care post-op.